Good afternoon, everyone. Welcome. I'm so very grateful that you've joined us here once again today. I'm Alina Dorian, the Associate Dean for Public Health Practice, as well as Equity, Diversity, and Inclusion at the UCLA Fielding School of Public Health. But I've also been a school principal for the last 10 years, which makes me doubly excited to be joined by all of you for our fourth in a series of webinars titled Principal Practices for Safe Schools. I want to quickly take a moment to thank our collaborating partners, the UCLA School of Education and Information Studies, the California Safe Schools for All team, the California Department of Education, the Association of California School Administrators, and our California Connected Consortium, consisting of the California Department of Public Health and our academic partner, UC San Francisco. Today, we are very lucky to have with us insightful public health experts, as well as our panel of incredible educators, esteemed school administrators who will pose questions to create a dialogue to better inform, empower, and create confidence in the decisions we need to make to open our schools and to keep our schools safe. We will begin by hearing from our public health experts and then transitioning into a Q&A from our education partners. We'll try to save some time in the end to address some of your questions. So put your questions in the Q&A, and thank you for those that submitted questions ahead of time. All of your questions and comments are very valuable in helping us design this series to truly meet your needs. So let me begin by introducing our guests. We're honored to have with us Dr. Naomi Bardach, who since December has served as the California Health and Human Services Agency's lead for the multi-agency Safe Schools for All team. Dr. Bardach is also an associate professor of pediatrics and policy in the Department of Pediatrics and the Philip Arley Institute for Health Policy Studies at the University of California, San Francisco. We're joined by Dr. Carol Glaser, the Assistant Deputy Director for the Office of the State Public Health Laboratory Director. Most of Dr. Glaser's career has been with the California Department of Public Health, where she served in a number of different roles, including both chief as well as medical officer of the Viral and Rickettsial Disease Laboratory and acting chief of the immunization branch. Most recently, she worked with Kaiser Permanente as a pediatric infectious disease physician and has been working with the CDPH testing task force to assist with the development of the antigen testing program for COVID-19 in the K-12 school setting. We're happy to have Ms. Anita Fullbright, public health nurse and COVID-19 school technical assistant specialist for the Humboldt County Public Health Department. She served as public health nurse with LAUSD and credentialed school nurse for Eureka City Schools in Humboldt County. She holds a Bachelor's of Science in Nursing from Mount St. Mary's College, a Master of Science in Nursing from Sacramento State, and Family Nurse Practitioner credentials from Sonoma State University. She's a Red Cross disaster nurse and has been honored as a Johnson & Johnson School Nurse Fellow. We're also joined by another Humboldt County partner, Ms. Katie Cavanaugh, the Director of Special Education for the Humboldt County Office of Education. Ms. Cavanaugh holds a master's degree in psychology with a specialty in school psychology. Prior to joining Humboldt County's Office of Ed, she served as the superintendent and principal for Trinidad Union School District. She also worked as a nationally certified school psychologist in public school districts, serving students TK through 12. We're joined today as our moderator, our own Dr. Shira Shafir, Associate Professor in the Departments of Community Health Sciences and Epidemiology at the UCLA Fielding School of Public Health. She's also the Director of the Master of Public Health for Health Professionals Program and an infectious disease epidemiologist, currently leading the monitoring and evaluation arm of the California Connected Partnership with UCLA, UCSF, and the California Department of Public Health to help build and train California's COVID-19 contact tracing and case investigation workforce. And of course, we are very honored to have with us our incredible school administrators, Mr. Jerald Ferguson, principal for Center High School in Sacramento County. Mr. Ferguson graduated from Cal State University, Sacramento, where he also received his single subject teaching credential, where he began his career as a middle school math teacher in the Grant Joint University Unified School District, which later became Twin Rivers in the North Sacramento area. He then transitioned into administration, serving his 9th year as a school site administrator and his 4th year at the principal at Center High School, which happens to be his wife's alma mater, so good move. And finally, this incredible lineup, we have Mr. David Sermeno, principal of El Portal Elementary in the Lowell Joint School District in Orange County. Prior to this position, Mr. Sermeno served for 6 years as the principal at Rivera Elementary in El Rancho Unified School District in Pico Rivera. He is an alumni of the Principal Leadership Institute at CenterX at UCLA, a proud Bruin from cohort 10. So once again, thank you all for being here. And now it is my distinct honor to invite Dr. Shira Shafir.
Thank you, Dr. Dorian. I always feel bad when they show that headshot of me because that was pre-COVID, and I don't know about any of you, but I just don't look like my pre-COVID self anymore. So it's an honor to be with you here as the moderator, and I'm really excited for the information that we're about to share. As Dr. Dorian mentioned, this is one in a series of seminars or webinars that we're offering. So before I turn it over to Drs. Bardach and Glaser, I wanted to just make sure we're doing a tiny bit of a refresher from some of the things we talked about before that will help put today's topic in context. So one of our first in this series, one of the things we had to talk about was the fundamental science as we understand it when it comes to COVID-19 transmission in school. And the biggest things to remember, the majority of transmission that happens in schools is happening from adult to adult. So we want to test everybody. We want to have a good sense of if someone is coming in and they're infected, so we make sure they're not entering into our school premises. But when we think about risk in schools, we really are thinking about risk from the adults coming within 6 feet of one another. We also know that the risk of transmission increases with the age of the students. So there are different infection and transmission risks when we think about high schools as compared to when we think about elementary schools. So those are just two of the basic science bits we wanted to refresh on before we turn it over to start talking about the testing options that are available and how they can be implemented to really give reassurance. We know, and we're incredibly excited that teachers are now getting vaccinated in the state of California. And that's an incredibly powerful tool that we have in order to protect everybody in school settings. But it's not the only tool we have. And testing is a really important component of our ability to open schools as safely as possible. We know that there are a lot of questions. So with that, I'd like to turn it over first to Dr. Naomi Bardach, and then we'll hear from Dr. Jerald Glaser, just to help us understand some of the science and the context, and then we'll have a chance to dive in a little bit more. So thanks, Dr. Bardach.
Hello, hello. Thanks, you guys. I'm going to try and do a relatively brief overview of sort of how to think about testing. Oh, sorry, ignore my email for a second as I'm getting my slideshow going. And then Dr. Glaser will talk more about the Antigen program, actually, that is sort of a pilot turning into a more robust program at the state. So just a brief testing overview. What do we mean by testing? Most of the time when people sort of say testing in schools, they're usually referring to what's called asymptomatic testing, which means ongoing testing of students or staff. And as Dr. Shafir mentioned, staff, I always think, prioritize the adult testing first and then plus minus students, although the students in the middle schools and high schoolers is prioritize them above the elementary students. For the asymptomatic testing, meaning ongoing testing at some kind of cadence, meaning every X number of weeks to figure out what's going on, because we know that there's a possibility of asymptomatic infection and therefore potentially asymptomatic spread in the schools. And so the asymptomatic testing is one of the safety layers that people talk about. And I'll say that historically and even now, we have maximized on a lot of other safety layers as a society, on masking, on physical distancing, hand hygiene, cleaning things well, thinking a lot about ventilation and focusing on outdoor activities. We have not, in America anyway, really maximized our testing. So it is one of the additional layers that as we continue to figure out how can we open up society, testing is one of those things that can help us. And as the vaccination rolls out, testing still can be a helpful component of it, particularly because we know it's going to take a while for everybody to get vaccinated, and we haven't gotten to the student part yet. So that's kind of the overall rationale behind the asymptomatic testing. There's a couple potential approaches to testing frequency and how you might want to start just thinking about it, because as people think about putting together a testing program potentially at their school, like how often should I do it and who should get it and all that. So one thing to say is there's two different ideas. One is something called screening testing programs, which tend to be, the idea is you're trying to screen for infections and keep all of them out of the school. It means that you usually are doing a very high frequency kind of testing, weekly, sometimes people even talk about twice weekly. Most schools are not doing that because it's such a high volume, but that is something that the CDC even recommends doing weekly in schools as one potential approach. Like I said, it's another layer that we haven't really maximized, but other countries do it sometimes. And it's something that as our testing capacity gets better, that's something to consider. Surveillance is the other thing that people talk about, which is doing it less frequently than weekly. Maybe you're doing a proportion of people tested rather than the whole community or the whole, everybody on campus. And that basically gives you, it keeps some infections out, but also it just gives you a snapshot into like, how are things going? And sometimes people can really use that information to reassure themselves, even if case rates in their community are going up. If their school numbers are low, that really helps people feel confident to keep the school open. And the other thing is that if you see the numbers going up, that helps you to better understand in our school, we should probably be doing some other safety practices, and it helps them identify where they might need to put those safety practices in place. Like I said, sometimes people do it weekly, every other week, monthly. There's different ways of doing it, but that's the rationale of why you might want to choose one frequency versus the other. And then I already mentioned this idea about staff versus students. Oops, sorry, trying to move my screen. Sorry, one second, Jonathan. I'm actually trying to give a webinar. Do you guys mind moving? the joys of sharing spaces with everybody during COVID. The ages of students, like I mentioned, you're going to want to think about, am I doing the high schoolers? Am I doing the middle schoolers? Am I doing elementary students? Because the risk of transmission is lower in the elementary students, then the need for testing is lower there. The adults are the highest risk, as Dr. Shafir mentioned. And so making sure that if you're thinking about where you're going to put your testing resources, that's where you would want to focus. If you have a middle school or a high school where there's a lot of mixing, where you don't have great stable groups, that might be another situation you might want to consider doing student testing. And finally, just sorry to say out loud, it's not a requirement by the guidance at all that there's ongoing asymptomatic testing, but it is something that people look to as another way of creating safety in the school. So a few last little things, the state resources to support asymptomatic testing in schools. Like I said, we want to create supports for people if they want to do it, but it's not a requirement. But the Valencia branch lab actually has a pretty high capacity for being able to do that. And then there's also the antigen testing pilot program, which Carol will talk more about. So this is just briefly about the COVID testing lab. It's called the Valencia branch lab. It does PCR testing only, and Carol will talk a little bit more about the difference between PCR versus antigen. And it has a pretty high capacity right now. If you sign up as a school for Valencia branch lab testing, you get test kits, you get sample processing in the laboratory, meaning they run the test for you. The results are 24 to 48 hour turnaround. There's detailed support and instructions for how to operate your testing site. And then there's a patient registration and parent consent form, all that's a software that's pretty light touch, and people have been pretty successful in using that software. It's done by the Color Genomics group. For the school that might be signing up, you submit a request for the number of test kits, you put together your PPE, you do community outreach, you provide the staff to gather the specimens, which we'll talk about in a bit, and then supervise self-administered, meaning the people hold their, like a patient or a student or a staff member holds their own swab, and they do it themselves. So it doesn't require staff who actually have to feel comfortable putting a swab in somebody's nose. So that's pretty important, because that can be very, that can make schools very nervous, anybody very nervous, that they have to be the one putting the swab in there. And then sample transportation, and then some costs are covered. You might need to cover some costs for transport if you don't use the state courier system. A bit on testing, paying for testing, because it's a huge question for people. And it's actually really helpful. When I learned about this, I was like, oh, this is a good way of sort of structuring it. The state actually pays for the kits up front, so schools don't have to take on a financial risk in that way. The state then seeks reimbursement from insurance, and insurance actually covers all staff. They're considered essential workers on site. And then Medi-Cal, I'm sorry, that looks like medical students. Medi-Cal, meaning Medi-Cal insurance, pays for student asymptomatic testing. That is bright, shiny new news as of this week. Privately insured students are not currently covered. They're not usually reimbursed, but that also is actually right now at the federal government. They're talking about whether or not they're going to be requiring insurance companies to approve and pay for asymptomatic student testing. So that's TBD. And then for the Valencia branch lab, the price of the test was $55 per test. And they actually, that was when they first opened. They've actually had a lot of efficiencies since then. And they just actually were able to change the price down to $21 this week, partly because of that Medi-Cal thing coming through, as well as just being more efficient, like the economies of scale. And then lastly, there's a staffing question. How do you pay for staffing? One thing to just also say, the Valencia branch lab is working on very close to having ready an ability for teachers to just collect it on their own. They don't even have to be on a site anywhere. They can just get the kit, collect it on their own, put it in the thing, and then they can bring it to the school to get it sent off. So that means that you don't even need a staff person to supervise them for that. Testing in students is a big thing. I've gone over my time, so I will not show you this video, but you guys can get the slides. It's a very cute video, and I'll put the link in the chat. And I think we'll probably defer questions and answers until later, but I'm happy to answer them now if you want.
Great. Thank you so much for that. Really good information and so current. Let's now turn it over to your colleague, Dr. Carol Glaser, to share further.
Hi, good afternoon, everybody. I'm going to hopefully share my screen. So I'll just give a brief overview about our pilot for antigen testing in schools. And really just want to start out by saying that in California, our schools really have this incredible menu to choose from as far as testing. There are some states where they only have antigen, and some states they only have PCR. But really, in California, there's the individual PCR option. There will soon be a pooled PCR option that's not quite ready, but it will be soon. And then the antigen program, which I'm going to be talking about. So just to try to think about these two things, because it's not a one-size-fits-all by any means. The huge advantage to antigen testing is that the results are available almost immediately, on site within 15 to 30 minutes of testing. And so that if there's any positives, you can immediately do contact tracing and quarantine. And the cost of the test is often less than the individual PCR. Now, Naomi just got through saying the cost has come down substantially. That's huge. It's a huge win as far as the PCR testing. So, it's not, the gap is not as wide as it was, but it's still cheaper. Right now, the test kits are free, although there are other costs associated with them. Certainly, the disadvantage of this test is that because it has to be performed within an hour, a collection, it really has to be done on site. And so there's additional resources that are required for you to be able to do this on site. And in particular, what's called the CLIA wave test, which I'll talk about. And it is actually less sensitive than a PCR assay. Just real quickly, what is this test? It's something that many of you have probably not heard of. And really what it is a simple sort of card test looking for the viral antigen from a nasal swab. And it's a qualitative result, very similar to a pregnancy test where you're looking for basically a line. And even though it's considered to be a very low complexity test, and there's certainly requirements of this test, more so than just an over-the-counter test. So as I mentioned, it is less sensitive than the PCR, but I think, many of us, as we think about it, and as a pediatric infectious disease physician, when I'm taking care of a patient in the hospital, I want to have the most sensitive possible test. I don't want any chance of missing it. However, when we're in a school setting, what we want to really pick up is who's most likely to be infectious. And that's what we think the antigen test is, because it's picking up that higher viral load. It's not necessarily picking it up the very beginning or the tail end of an infection. We're probably going to pick out most kids or teachers that are most likely to be infectious. Not perfect, but a really nice test. And so when we start to think about how to set this program up, we kind of looked throughout the U.S. to say, well, what's everybody else doing? And so several other schools had the program set up. Some of them in Maine, Massachusetts, and Missouri were really just looking at kids that were either symptomatic or had an exposure. In other states like Minnesota and Texas, they were really doing it on asymptomatic as well as symptomatic or exposed, so more comprehensive program. And then in some states, and I think Naomi alluded to this, some states just do a certain percent per week of the staff or the students. So we looked at, there was no uniform way of doing this across the country. So back in November and December, we started to figure out, well, how would we even begin to think about this test and implementing it in schools? We know that schools are not laboratories. We know that schools traditionally, they're doing a lot of testing, but it's more like on tests, but it's not actually medical tests. So this would be a new thing. And we found a handful of schools that were willing to work with us, and we clearly called it a pilot program. And we identified a lot of areas where it was a problem. And so we said, well, how can we fix that problem? So, you can't fix something until you know what it is, the problem. One of the biggest barriers we ran into was the fact that because it's a CLIA wave test, technically a school needs a lab director to be in charge of it. Not a lab director on site, but somebody that has some oversight of the training and the competency. We also needed to find an ordering healthcare provider. We also needed to provide enough training, because unlike the PCR test, this is something that is done on site, not sent out. So it is more complicated than the PCR. And then also, because it is a test, it's reportable to the health department as well as back to whoever the participant, whether it's the teacher that was tested or another staff member or to the guardian or the parent of a student. So while these things all seem like a lot to look at, they are very surmountable. So we looked as far as the CLIA waiver. We tried to do some shortcuts, and we thought we could make the application smoother. But in the end, what we ultimately, and we went back to other states and said, well, how are they addressing their CLIA issue? And really, a number of other states were using a single statewide CLIA waiver for all of their schools. And so we initially were reluctant to do that for various reasons, but the more we thought about it, we became very comfortable that we could do that as long as we could ensure certain things. And in particular, we needed to ensure that we could provide the appropriate training to the staff, both on how to do it as well as how to report it. And we also needed to make sure that whoever was going to serve as that ordering doctor or healthcare provider for this test, that their roles and responsibilities were met. So that we needed to ensure all of that. And so we, to solve some of those issues, we developed a very cohesive training process, which I'll talk about in a few minutes. We also worked closely with a software company to really make sure that they could help basically report to the participant, to report to the health department, to help with quality control. And we looked at various software companies. We're continuing to explore various options. The one we're mostly closely aligned with is a company called Primary Health. We developed a very robust playbook and training module. It's just to give you an idea of the table of contents, giving you all the way from introduction to very sophisticated training. And then finally, we have a list of modules that have to be looked at before somebody can do that. And all of this is a bit daunting when people first start looking at it, but honestly, most of these videos are 5 to 10 minutes long. And, one of the questions that we got early on as we met with different people is, well, how would we ever even get young kids to be able to self-swab? And so we made a video of kids, this particular child in kindergarten, and there's many other kids being able to self-swab. So because much of our program is based on the fact that we expect the participants to be able to self-swab. And then we also developed a competency quiz so that when we got through the training, we wanted to ensure that they understood all of the issues that they needed to about the test. As you can see, it looks like a pretty simple test to perform, but there's a couple problem areas, so we kind of test for that in the competencies quiz just to make sure that people have learned this right. And then once people have gone through all of these different phases, we then ask the superintendent to go back through and certify that their personnel have been trained in various areas of personal protective equipment, HIPAA issues, as well as the Bardach antigen test itself. So, then at that point, once a school has gone through the training, we enroll them. And like I said, there's a number of different steps involved as far as enrolling schools. And at this point, we've enrolled about 58 total districts enrolled. And again, that's districts. We know that some districts are just 1 or 2 schools. Some districts have 50 or 60 schools. They're not necessarily all running up, but we've got a lot of people. There's been a lot of interest in this program. And I want to just talk a little bit about some of those success stories in a minute. But in general, we recommend that testing would be at least once per week to both students and staff. If possible, we'd like twice a week on the staff, just because, as Naomi mentioned, that's where most of these infections are occurring. So if we could get staff tested twice a week and then 1 to 2 times weekly for students. And we've really, in the last even 2 weeks, really just begun to launch because, again, our first couple of months was really working out all the different issues because we're really kind of making the school a laboratory. And so we had to work out a number of obstacles. And at this point, we've tested over 4,500 individuals. There's only been 20 positive results, which, an overall positivity rate of 0.4%, so much less than in community for sure. So I think that, that's good news. We do anticipate these numbers to go up quite a bit in the next few weeks. So I think this is really what I want to spend a few minutes on is.
Sorry,
you know,
Dr. Glaser, but before
Yes.
you move on to success stories, we want to make sure that Anita Fullbright and Katie Cavanaugh have an opportunity to share the Humboldt County success
Oh,
story.
sure.
All right,
Yeah.
thank
Okay.
you.
This
So
is, I
with,
think, my last. Okay, this is my last slide, but that's fine.
okay. Why don't you wrap up and then we'll turn it over
okay.
to Anita and Katie.
Yeah, so I just say that there's a lot of reports from teachers and parents that feel much safer with this testing, particularly because the results are available right away. That rapid turnaround time really gives them that ability to feel comfortable. And we've detected cases that were either pre-symptomatic and people got sick later, or those that had really mild symptoms and they thought it was allergies, or maybe they had another diagnosis like a strep throat. And I think that's all I have. And so I'll leave it at that.
Thank you so much for sharing that. And I hope we have time to come back to that, how people are feeling and sort of the reassurance that they're getting. So hopefully we'll return to that after we have the chance to hear from how this has all been rolling out in practice with, we'll start with Anita Fullbright from Humboldt County. I'll turn it over to you. Thank you.
Hi, thanks so much. And I know we're running behind, so I'm going to hit the highlights. Could I have my first slide, please? Thank you. Well, I want to introduce you to Humboldt County. This is about 4,000 square miles of beachfront property filled with redwoods and rivers and a population of about 136,000 residents. This map is 32 independent school districts ranging from 5 students to 3,650 students. So we have everything that we need to consider. Lots of just special needs. Next slide, please. About 2/3 of the population lives in the 110 square miles right around Humboldt Bay, which leaves about 46,000 people occupying the rest of this huge area. And most of our services are located in the urbanish area. So everyone else has to either create their own service or travel long distances to get them. Can we turn this slide off just for a minute, please? When the pandemic began in March, our local health department could process about 10 to 30 singleplex PCR tests per day. And we've been rapidly building capacity as fast as we can. We can now do 2,250 asymptomatic tests and about 300 symptomatic tests per day at the health department. But by December, it was obvious, given the new state guidelines for schools, that we were not going to have the capacity to test all of the staff and students that would be either required or recommended, especially given the distances involved for most of the outlying districts. So at that point, the Public Health Department offered to help connect Humboldt County Office of Education with the Valencia Lab, and also to help train anyone who was interested in collecting specimens for their districts, either for the Valencia or for the Binax. And my colleague, Katie Cavanaugh, is going to tell you about her challenges. But before I turn the presentation over to her, I want to brag a little bit about what we're already doing. Can I have that third slide, please? Yeah. There we go. So the Valencia Lab provides the specimen collection kits, but there are other supplies that the school has to provide, basically personal protective equipment, a computer, scanning device, space, and personnel. Next slide. Now, the HCO graphics department made signs for their drive-through site at one school. But just as an aside, I'd really like to see this being something that the school kids did it as an art project or a poster contest. Next slide. I know everyone has seen drive-through clinics before, but the people who've been trained to observe self-testing all wear personal protective equipment, and they use a portable computer to check the folks in being tested. Next slide. So they provide the kits to the person being tested, and the person does the testing, but with the explanation of the people who are giving them the test. Next slide. They do it right in their car. After they've collected the specimen, they scan them into the computer so that each specimen is associated with the right patient. The specimens all have barcodes. and then they put the specimen in a container for delivery to the lab. And I have to say that none of this would happen, final slide please, without giving lots of credit to our super school nurse, Lynn Mahoney, who has really done just a crack job of implementing this testing program. And I think Katie could probably now tell you how much trouble she had putting it together.
Well, thanks, Anita. We sure do have a wonderful team. So I am just going to take a couple of minutes to walk you through what our process has been. So as you all know, as school leaders, we need to constantly adjust. We are nothing if not nimble and are always meeting the health and safety needs of our communities. Being focused on health and safety has been a bit different over the past year, and that's led us to COVID-19 testing in schools. So today I'm just going to go over what the program design that we implemented at HCOE was and is, the support that we provided both to our sites and to our districts, and some of the lessons learned. To expand on what Anita just shared about Humboldt County, HCOE consists of their 32 districts. We also have 15 charters and 4 county office run student programs. Our county office programs serve students with moderate to severe disabilities, court and community enrolled youth, and other itinerant programs. Of our districts, we have 30 to 50% of our schools who are offering in-person instruction. And like she said, we have a mix between 9 and 4,000 enrolled students. So as you can imagine, we have anywhere from in-person, hybrid, learning hubs, or appointments. 6 of our districts are currently testing staff for COVID-19 using the Valencia lab on their sites. We also have many more who are in process of either using Valencia or the Binex. One of the partnerships that has been pivotal throughout COVID is with our local public health. And our Humboldt County Public Health was able to prioritize vaccines for educators. So timing wise, right around the same time as we started to pilot our program with Valencia Labs, our local public health department offered the first vaccines to educators. To date, we have all 3,100 of our public school employees who've been offered a first round of vaccines, which is huge. So early on, it was really important to lean on what our organizational values were, which are trust, respect, and collaboration, very similar to the values that I'm sure you all hold. This is because testing for COVID-19 at schools appeared to be a radical leap. We found it pivotal to review what our purpose was. Back in May, we established what we call our Safe Schools team. And this team has representatives from our administrative and our certificated union. This group really indicated they were interested in increased staff testing. In addition, we knew that there were some state mandates coming, and we also have many rural districts. Like Anita referred to, we have some districts who live about an hour and a half from the nearest testing site, making it very difficult for them to comply with the state testing recommendations of half staff every 2 months, let alone any increased cadence that they may be required to have. So being a rural county, Valencia Labs made sense for some of our districts, including the county office. We started with a pilot program, and this was both to inform both our districts and to build our capacity. When you look at a program and increased cadence and how often are you going to do it and how many people are you going to test, it really made sense for us to start slow. We found that with Valencia Labs, there was little or no cost. It was a reliable test and it was adaptable. We could start with testing just a few staff members and potentially or eventually increase that to many staff members at an increased cadence, as well as offering it to students. We also knew that it was really low risk for observers. As you saw in the staff pictures before, they were wearing a lot of PPE. But the risk to those individuals for observing the test is very, very low. That was a really important factor in us choosing to use Valencia. Some of the challenges that came up were transportation. We're a rural county. We needed to figure out how to get Valencia lab samples all the way to Valencia. We also needed to identify staff, provide training. We needed to keep a finger on our pulse of the changing mandates, and we had to figure out how to schedule people. The software that's included doesn't include a scheduling piece. We found that using Office 365 worked for us, but there are other solutions out there too, like Sign Up Genius. So our process was really first to secure transportation. We knew that unless we could get these samples out of the county, it really wasn't going to be any use to us. We were able to communicate with the California Courier Network and advocate for an installation of a drop box actually on our site. We then shifted our staff so that that drop box would be available to any school district in our county to be able to drop off samples any day of the week for transportation down to Valencia. Well, it does take about a day and a half for our samples to get down to Valencia. That's the best we can do right now. It's still free and covered by the state. And we are working with public health to have a quicker turnaround. The next piece was really cascading communication. As you all know, communication is pivotal to anything, any initiative being positive or fruitful. For us, this was an overview of the Valencia program for all of our districts. Even if they weren't going to be adopting it, they needed to know what we were going to be doing. We also wanted to overview for our leadership team and share with our Safe Schools team down to the staff level at staff meetings. We also needed to find willing and able staff, meaning the staff had time and they weren't completely freaked out by the idea of testing for COVID on school sites. So we needed to communicate again that it was very low risk, even though we know that it's low risk. There's a lot of fear around testing for COVID. And like the doctors mentioned before, it's outside of the norm of what we're asking our staff to do. So we really spent a lot of time enlisting and talking to our staff and asking those questions about what their fears were and really talking about some of the barriers that they had. We had site visits and partnered with Operation of Emergency Services. We established 2 virtual training videos. We also had virtual training sessions where people could just pop in, ask questions, and we could help them along the way. We also needed to design some of the nuts and bolts. Were we going to do something that was drive-through or walk up? And how are we going to schedule the appointments? So really, out of all of this, not unlike any other program that you're implementing, relationships are important. It was really important for us to advocate for the vaccine for our staffs and public health was wonderful in being able to offer that. We found it very, very important to train our staff, both in what HIPAA compliance was, what a PCR test was, and then really walking through what this would look like to dispel any of the fears that they may have. It's really important to communicate often and for us to start small. So that's all I have to share today, and we look forward to grow our program and invite any questions that you might have.
Thank you so much, both Katie and Anita, for sharing what worked and what you want others to know so as not to sort of repeat the same learning experiences that you had. Now we're really excited to have the opportunity to hear from some of the colleagues of the participants. So who are the people who are actually doing this, and like you, what questions do they have? So we're going to start with an elementary school principal and his question. Mr. David Sermeno, I turn it to you for the first question.
Thank you for all the information so far. What guidance or support do you think might be available for school sites to be able to respond to families or students that would refuse to participate in testing?
That's a great question. And I'm going to first turn it over to Dr. Bardach to answer that. But just put it on your radar. Katie, I'm coming to you next, since you've already done this at Humboldt.
Yes, that's great. We know that there are going to be students and families and staff who say that they would not like to participate, and that's 100% fine. There's no There's no mandated testing for COVID-19 in the state, so nobody's going to say you have to put the swab in your nose. I will say, and maybe Katie will also reflect on this, and probably Carol actually in her experience in addition, is that that it can be that you can sort of explain to them what, giving them the rationale why, and actually there's a lot of questions in the Q&A about privacy protections and ensuring them that the data is safe and stays private, except for it does have to get reported up to the state if there are positives. So that is something that's just part of all COVID-19 testing, always, no matter where you are, what it is in the state, has to get reported up. But other than that, it doesn't get shared you know, in some kind of public kind of way. Although also it does go to school administrators, so the schools are able to be aware and help manage any kind of infection risk on the site. But giving people transparency and also reassurance that actually it will help the community and stay safe, that can be helpful.
And Katie, to you, if there's anything to add from your experiences in Humboldt.
Yeah, thanks, Dr. Bardach. And, you know, one of the pieces that's really informative for our community is just why are we testing? And going back to the purpose of why are we doing this? And then hearing whatever their questions are. Their questions may be about privacy and what are we going to do with results, but their questions may be something that we may not anticipate, like what does it look like, or I don't have a car, or who's going to get the results and what happens if I'm positive, and how long am I going to be out of school? How long is my kid going to be out of school if they test positive? So really hearing what the fears and the questions that they have about testing and making sure that we're getting out in front of the why we're providing more testing has really been very important for us.
That's incredibly helpful. And Anita, do you have anything to add to that?
I think it's really important to make sure that they understand that this is not the swab that tickles the brain. This is more like picking your nose. So I think that once the kids, when it comes to doing children, it's a little easier for them to understand that nobody's going to hurt them doing it. It's a very benign procedure. Kids like reassurance, and they like that kind of talk too. They like to think about it in those terms.
It's true for children and adults. The adults, they're like, I don't want to do that terrible test. And you're like, no, it's just front of your nose. You're okay. That's the adults also, understandably.
I think great advice from all of you. Thank you. For our next question, we turn it over to the winner of this webinar's Most Awesome School Spirit Background Award, high school principal Jerald Ferguson, please.
Good evening. Thank you. We have our Cougars. Question that I have, and I know some of it may have been covered in the last answer. Given all the different tests and kits that are available, what are the basic privacy protections that these kits may have in common? And are there any concerns schools or districts should have to ensure that we do not inadvertently violate student or staff confidentiality?
Great question. And I know schools are really familiar with FERPA, but HIPAA, as has been mentioned a couple times, is a whole brand new thing. So Dr. Glaser, could you speak briefly to some of the privacy issues and sort of alleviating some of the concerns around that?
Sure. So, we share that concern, and part of our training will include HIPAA. And I've heard from some teachers that that's not appropriate for us or not. We still want them to do it, and we really emphasize that, even though you might want to go tell somebody that Johnny in the first grade is positive, it has to be held very confidential. So we really, really stress that in our training. And even in that competency quiz, we put in a couple of trick questions just to continue to emphasize that. We can't really emphasize it enough.
Great, thank you. And Mr. Sermeno, you have the next question.
This question piggybacks a little bit on my first question, but like the guidance and expectations that could be out there for students, for our students with special needs, or students with very special health needs, or young students, is there any guidance for testing with those student groups?
Yeah, great question. And we know special needs are a real topic of concern that continue to come up. So Anita, would you like to answer first, please?
Sure. I've had a lot of experience working with kids in special education. And most of them, especially the seriously involved students, come with a lot of assistance. And what is important there is to make sure that that you have the trust of the student. So there needs to be somebody with the student who can advocate for them and reassure them and trust them. Like I said, the kids, even involved kids, have a lot more complicated procedures that they are subjected to regularly than this nasal swab. And once they have had it done, they can accept it much more easily than people suspect. I think there's an awful lot of fear that we have of people in special education, whether or not they're going to be able to cooperate, but I've found that most of them are very cooperative and their families are very cooperative. And the aides that work with them are just absolutely amazing. They're patient, and it's just a matter of taking the time to do it and to do it right. So it does take longer with special needs, but it certainly is doable and worth the effort because it's a very vulnerable population.
Thank you so much. And then for our last panelist question, back to the home of the mighty Cougars, Jerald, we're coming to you.
Excellent, thank you. I might prefer to be where Miss Fullbright is on her background though. Is a school district able to require students to be tested? And what is the youngest age that a student could be tested?
You snuck in a twofer there, Jerald. All right. So for the requirements, I'll go to Dr. Bardach for the answer, please. Is it possible to require?
I'm so sorry. I looked at the Q&A for 1 second and I just didn't totally hear the whole question. So was it, is it a requirement to do school? I heard the second half, but the first half was, is it a requirement? And the second half is how young can you go?
So I think rather than is it a requirement, the question is, can it be a requirement?
Yeah, it can't be a requirement in terms of you can't say to somebody, you have to get tested or you can't come to school. That's like, it's against California law to say something like that. So that's one piece. And then the youngest, you know, even a small baby can be tested in the school's program, you know, that we're sort of looking at kindergartners, and TK would be the youngest that we sort of have in any of these programs. And the video that Carol referenced in her slides and that I referenced in my slides and I put in the chat actually in one of the questions, it shows kids in the TK age who are able to do their own supervised self-collection.
Fantastic. So I know Dr. Bardach is quite frantically trying to answer as many of those questions in the Q&A as possible, but I want to flag a couple and have them answered by the panel. So one that I think is particularly nuanced is what about testing for those who have been fully vaccinated plus their 2 weeks after their second shot? What are some of the guidance or requirements, not requirements, guidance or thought around testing for those who are vaccinated right now? Dr. Glaser, can I turn that one to you?
You're on mute, Dr. Glaser.
It's going to be a while before we actually have kids vaccinated, so I don't think that's going to be an issue for a while. Certainly, if they were at all symptomatic, I'd want them tested and to go home anyway. And I will say, you know, a lot of people say, well, if they're symptomatic, they're not supposed to be at school anyway, but we have to just face the reality. I mean, kids will get a little bit of a runny nose or a little sore throat. And this, as we know, COVID can be such a subtle illness. So we have indeed picked up kids that were really mildly symptomatic. And I understand why their parents, you know, still had them go to school. So going back to the vaccine question, I think that it's going to be quite a time before we get all of those kids vaccinated. So I think we'll probably decide if we even still need testing at that point in our schools. But for now, you know, I think we're just really trying to get the project up and running. And really, the way I look at it is it's really in some ways up to the schools how they decide to use this tool. Even though we come up with a general reference about, you know, once a week for the students and maybe twice a week for the staff, each school right now is sort of figuring out what works for them and what makes their teachers and parents and students feel safe.
And I saw your colleague, Dr. Bardach, hop off mute, so I think she might have something to contribute. And I'll also ask, in answering, could you address staff? Because we know that teachers are beginning to get vaccinated. So hopefully within, a month, we're going to have all these vaccinated teachers. So what about the adults at the school?
Yeah, I was just going to come off because to give people a little bit of, there's the federal government is also thinking about this. The CDC, the Center for Disease Control, is also thinking about this, as well as all of us, like in the state in California, trying to think, does vaccine, how might vaccines change things around testing, around schools, around any of the other safety mitigation layers, et cetera. The recommendation right now is vaccines don't change testing. But my understanding is from the federal government that they are working on trying to figure out, is there any different guidance that they might give as we get more experience with the vaccine and we've had a lot more people vaccinated. It'll begin to inform our ability to actually say something about, can we change our behavior? Can we not change our behavior? Right now, there's no change to the testing recommendations, but stay tuned.
Thank you very much for that. And I know we've had a lot of detail and nuance and questions, but the last question I'd like to pose is, what have you noticed with respect to how it makes staff at the school feel? And does it have an impact on morale and confidence going into the workplace when there is a testing program that's in place? And Dr. Glaser, I know I cut you off before when you were starting to talk about this, so I'll go to you, please.
Oh, great. Yeah, so I would say, the experience I vividly remember one of our first schools that we got up and running. And remember, this was a big lift. This was a 2-month process of sorting out all of the problems, how to get around it. But the superintendent called me the evening of their first day, and I think he was doing cartwheels. He was just overjoyed. And it was only the staff that had been tested, but 25 had been tested and they were all negative. And he was just thrilled with that. And because he had instantaneous results, he had a dashboard, and it made everybody feel great. On the other hand, I also got a call from a superintendent when they found 2 positives. They were thrilled with that because they identified them, they sent them home, and they could make action immediate. So I would say of the schools that have done it, once they've gotten it up and running, it's really influenced them, and it's made, everyone from the superintendents to the staff to the teachers and the parents and the students feel safer. So, obviously we're working at schools that volunteered to be part of this program, so we didn't try to, oversell it, but they've really liked it once we got through, the training, and, it is a bigger lift than doing the PCR for sure.
Thank you. And Katie, from your experience in Humboldt, do you have anything to add there?
Yeah, the only thing I'd like to add is that when you bring testing capability to your site, to where people see it on a daily or a weekly basis, they're more likely to engage in that testing. So we all know that the recommendations are that you offer testing for half your staff at least every 2 months, and that cadence can change. And the recommendations out there are that you're doing it more and more frequently. But there's a privacy concern with asking people about their health issue. You can't ask somebody if they've been vaccinated. You can't require them to go and get testing all the time. But if you give them the information and then the opportunity, they're much more likely to engage either in the conversation about whether or not they want to, or actually engage in that testing. So for us, we have no idea how many of our staff were engaging in that routine testing prior to it being implemented on our site. But now we're able to know a bit more about how many of our staff are actually engaging in this weekly or biweekly testing, which helps everyone, I think, in the community.
And for the scientifically minded, if you also tell them that they're in some ways participating in research by being tested after they've been vaccinated, so we can continue the surveillance. Is it really true that the vaccines continue to protect us? And that's one way to find out, is by continuing to test.
Well, thank you very much to all of you for your insightful questions, for your insightful answers. And with that, I'll turn it back over to Dr. Dorian for the wrap up.
Thank you so much for sharing all of your valuable time and expertise with us. This is more than appreciated. I know that this testing, this is probably the webinar where I've noticed we've gotten the most Q&A. So we will make sure to take all of your questions and move them over to the Safe Schools Hub so that we can actually start adding that to the FAQs that will go up there as well to ensure that we're answering all of your questions. As I mentioned in the beginning of our webinar, this was the 4th in our series. So we have one coming every Thursday. And really the idea is to help school administrators have a forum to be able to dialogue and work with our subject matter experts to better understand just implementation of all of the guidance that's been given to us, but really taking into account the specific needs and realities within our schools. As I said, our next webinar will be next Thursday, March 11th from 4 to 5. We also have a risk communication training. So going off of what Mr. Sermeno talked about, it's for school administrators to really think about the tried and true practice of risk communication. Yes, during COVID, but really to think about kind of all hazards and all challenges that you will be faced with. All of this information, by the way, that's on March 12th, and all of this information is on the Safe Schools Hub. We can put the link in the chat as well. If you go there, there's all of the other webinars are also recorded. You come down to where it says Virtual Training Academy, and there will be a library of all of our webinars that are recorded there, as well as some of the other trainings that are happening through that portal. So we're very excited that you are here. Again, thank you for being with us, and we look forward to seeing you all next week. Have a good afternoon.